Hello, this is Dr. Emma Nichols, and this is the latest information on new FDA approvals for the week of February 2nd through February 9th, 2024. First up this week, we have Eplontersen, also known as the brand name Wainua, which has been granted Fast Track designation by the FDA for treatment of transthyretin-mediated amyloid cardiomyopathy, that's ATTR-CM in adults. Eplontersen, a ligand-conjugated antisense or LICA medicine, inhibits the production of transthyretin, TTR protein. It's under investigation in the CardioTransform study for both hereditary or wild-type ATTR-CM. Eplontersen was approved in the U.S. in December 2023 for treating the polyneuropathy of ATTR. ATTR-CM is an underdiagnosed and potentially fatal disease characterized by the accumulation of misfolded TTR protein in the cardiac muscle, leading to heart failure and death within 3 to 5 years of onset. ATTR-CM includes both genetic and wild-type forms, affecting an estimated 300 to 500,000 patients worldwide. Eplontersen is being developed and commercialized under a global agreement between Ionis Pharmaceuticals and AstraZeneca. Also last week, the FDA accepted 2 supplemental biologics applications, SBLAs, for Nivolumab, also called Opdivo-based regimens for the treatment of resectable stage 2A and 3B non-small cell lung cancer, NSCLC. Nivolumab is a PD-1 immune checkpoint inhibitor first approved in 2014. The SBLA submissions were based on positive outcomes from the Checkmate 77T trial, which evaluated nivolumab in combination with chemotherapy followed by surgery, and adjuvant nivolumab as perioperative treatment for resectable NSCLC. This trial demonstrated improved event-free survival, pathological complete response, and major pathological response. Nivolumab is already indicated across various stages of lung cancer and other cancers as both a neoadjuvant and adjuvant agent. The FDA has set a PDUFA goal date of October 8th, 2024 for the current SBLAs. Nivolumab is manufactured by Bristol Myers Squibb. Also last week, the FDA has accepted GSK's application for priority review for extended use of its respiratory syncytial virus, RSV vaccine, Arexvy, in adults ages 50 to 59 at higher risk for complications. Arexvy is already approved in the U.S. for adults aged 60 and older for the prevention of lower respiratory tract disease caused by RSV. Approximately 177,000 adults aged 65 and older are hospitalized annually due to RSV. The SBLA for Arexvy's expanded indication is supported by results from a phase 3 trial evaluating the immune response in participants aged 50 to 59 with stable chronic diseases, as well as those without chronic conditions compared to adults aged 60 and older. Arexvy, which was first approved in May 2023, is the inaugural RSV vaccine to receive FDA approval. The CDC's Advisory Committee on Immunization Practices, ACIP, recommends Arexvy for individuals over the age of 60. The FDA has assigned a PDUFA date of June 7th, 2024 for the additional indication in this younger age group. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Visit nascentmc.com. That's nascentmc as in medical communications.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad boards, summaries, and much, much more, all for the price of a single freelancer, but with a much wider selection and with a background in the specialty that you need for your specific project. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Also, last week, the FDA approved an extended indication for Boston Scientific's WaveWriter spinal cord stimulation systems, SCS, for the treatment of chronic low back pain and leg pain in individuals who have not undergone previous back surgery. This condition is often referred to as non-surgical back pain. The approval was supported by the results of the SOLIS randomized trial, which provided one-year data showing that the WaveWriter SCS systems met its primary endpoint of a 50% or greater reduction in pain at the 3-month interval. At the 1-year mark, 84% of patients using the system experienced substantial pain relief with a pain reduction of 50% or greater. According to the manufacturer press release, first-line treatment for people with chronic back pain is usually limited to conventional medical management, such as physical therapy and medication, which are not effective for many people. Effective chronic pain management may lead to improved quality of life and reduced opioid use. Also, last week, the FDA has approved an investigational new drug application for OK-101, marking the first time the FDA has cleared an IND specifically for the treatment of neuropathic corneal pain, or NCP. NCP is recognized as an orphan disease by the National Organization for Rare Disorders. OK-101, a lipid-conjugated chemarin peptide agonist targeting the ChemR23 receptor, has demonstrated potential in reducing inflammation and pain in ocular conditions. The drug's development includes a novel approach to enhance ocular residence time, showing promising results in a phase 2 trial for dry eye disease, which shares symptomatology with NCP. The upcoming phase 2 clinical trial for OK-101 in NCP is set to begin in the second quarter of 2024. The approval was granted to Okyo Pharma Limited, OKYO Pharma Limited. The FDA has also granted a 510(k) clearance to Viz-ICH Plus, an algorithm designed to automate the identification, labeling, and quantification of segmentable brain structures on non-contrast computed tomography, NCCT images. The approval introduces an advanced solution for the accurate and quantifiable measurement of intracerebral hemorrhages, a condition representing up to 15% of all strokes and characterized by high morbidity and mortality rates. Viz-ICH Plus is specifically indicated for the analysis of intracranial hyperdensities, lateral ventricles, and midline shift, offering volume measurements of brain bleeds to support timely and informed treatment decisions. Also automates the traditionally manual process of measuring brain bleeds. Viz-ICH Plus is being developed by Viz.AI. Also, last week, the FDA has granted Fast Track designation to vepdegestrant, ARV-471, for the treatment of adults with estrogen receptor positive, HER2 negative, locally advanced, or metastatic breast cancer who have previously undergone endocrine-based therapy. Vepdegestrant is an oral PROTAC estrogen receptor degrader under development by Arvinas and Pfizer. The decision by the FDA is supported by data from the phase 1/2 VERITAC trial, which has shown significant efficacy in patients with this type of breast cancer. Vepdegestrant is also being evaluated in combination with various other therapies, including palbociclib, also called Ibrance, in the first-line setting as part of the ongoing phase 3 VERITAC-3 clinical trial. And also last week, the FDA has cleared VerTouch, VerTouch. It's a novel handheld imaging tool designed to improve the accuracy and consistency of spinal punctures. This device aids healthcare providers in performing spinal punctures with greater precision directly at the bedside. VerTouch leverages a proprietary spinal mapping technology, generating a 2D image of lumbar spinal anatomy, helping users visualize the key landmarks of a patient's spine to inform their decision and guide where to initiate needle placement. The traditional approach to spinal punctures relies on palpating the patient's vertebrae and inserting the needle without visual guidance, with a rate of first attempt failures estimated between 40 to 60%. This approval was granted to Intuitab Medical. All right, that's it for this week. Thanks so much for listening. I'll be back every Monday to report on some of the things coming out of the FDA that last week. Do check out my free course on ChatGPT-4 for medical writers and editors. You just need to go to learnamastyle.com. That's learnamastyle.com. And it's just a really short, very actionable course that medical writers and really anybody writing about medicine or working in the industry can use to help to speed up their workflow. And then I also like to announce that I've got a brand new course coming up for registration on March 7th at 9 a.m. And depending on when you're listening to this, but it's AI in Medical Writing and Editing, Blueprint for Success in a Changing World. And it's going to be a course that can really help you get up to speed as a medical writer in this brand new era with this little thing called generative AI, which is kind of changing the landscape. So I hope that you'll be able to just check that out. Go to learnamastyle.com for details and to get on the wait list for that if you're interested. And yeah, so I hope that that will be of interest to you. All right. And then you need to come back Monday. And also, please tell your friends or colleagues about this podcast if it might be of interest to them. I think it's useful for anybody that's in medical writing and also in the pharmaceutical industry just to learn about all the different random things going on that may or may not be, related to your direct field, but it's good to know about the entire field, about all the developments, or some of them anyway. Can't cover them all. All right, well, I'll talk to you next week. Thank you.